This administration just keeps proving that cruelty is the point. They are literally trying to cull the herds of people that they deem unworthy. This goes right along with that. HHS plans to cut the national self-deletion program for LGBTQ youth. So that is where we are right now. They are cutting this lifeline to people that may be at risk. It says in February, the program received an average of 2,100 contacts per day. The federal government plans to eliminate services for LGBTQ youth who call 988, the National Self-Deletion and Crisis Hotline, according to the Health and Human Services budget draft leaked last week. The budget, first reported by the Washington Post, would go into effect in October if approved by Congress. Since the hotline's launch in 2022, callers have been able to speak with counselors trained to work with specific at-risk populations, including the LGBTQ youth, who are 4 times more likely to attempt to self-delete than their peers. The Service for LGBTQ Youth has received 1.3 million calls, texts, or chats since 2022. In February, the program received an average of 2,100 contacts per day. Here we are cutting off the nation's lifeline to those in crisis, says Paul Del Vecchio, former director of the Substance Abuse and Mental Health Administration's Office of Recovery. Due to the discriminatory practices of the Trump administration, they're pulling that life preserver away from thousands and thousands of people. Mental health experts say that trained counselors provide key cultural competency to LGBTQ youth, understanding the stress caused by recent political attacks, the importance of using appropriate pronouns, and the ways in which the youth often lack of family support and harassment. And I can see why now they're cutting it, because that's all this DEI, and they're talking about programs, and all of this is so woke. But they are literally impacting or potentially impacting these people that are at risk. All right, so this person said that this quote says, "I worry that LGBTQ youth people will reach out to 988 and not receive a compassionate and welcoming voice on the other end, and that will only deepen their crisis." That quote is from Jansen Wu, Director of Advocacy and Government Affairs at the Trevor Project, a LGBTQ self-deletion prevention organization. The Trevor Project, one of the handful of organizations that make up the LGBTQ plus youth subnetwork, responds to about half of the 988 calls and texts from LGBTQ youth. This year, the subnetwork received an estimated $50 million in federal funding. Trump's first months in office have been particularly harrowing for transgender youth. The president has signed executive orders restricting access to gender-affirming care for young people, barring transgender people from serving in the military, and threatening to prosecute teachers who support non-binary students. Under the leadership of Health Secretary Robert F. Kennedy Jr., HHS has already cut about a quarter of its workforce. SAMHSA has been eliminated, and the mental health initiatives have been consolidated with disparate programs in a newly created administration for a healthy America. The leaked budget proposes further sweeping cuts to HHS, including a 40% budget cut to the National Institutes of Health, eliminating funding for Head Start, which I talked about in another article, the Early Childhood Education Program for low-income families, and a 44% funding cut to Centers for Disease Control, including all of the agency's chronic disease programs. This administration is showing that there are certain demographics of people that are disposable, and they have been doing that ever since they've been in office, less than 100 days in, and they are just slashing through things and upending people's lives. This will definitely hurt the LGBT community, and all of these other cuts are just hurting families that are poor. They're hurting the elderly. They are hurting working mothers. Every single thing that they do. Cruelty is the point. All right, y'all, join the conversation. Let me know what you think. Go ahead and subscribe, and we will continue these conversations.